team, surgeons, medical professionals and experts to share insights, techniques and advancements in the field of
4 centimeter, 2 to 5 centimeter. I would prefer to do an IPOM plus in this patient.
Right.
So we go for a laparoscopic intraperitoneal only mesh hernioplasty, and our plan would be to do the, it looks that there is omentum is the content. So we reduce the contents and then we fashion the defect, and then we will probably close the defect with one of these braided sutures, and then we will put a mesh. A mesh of this size would be around 12 or 15, because it needs to cover, as you know, 5 centimeter or around. I think 15 would be enough to do a defect. The mesh used would be mesh for IPOM, because we should avoid metal now.
Right.
Absorbable would be enough. Even some people would use non-absorbable. Absorbable would stay there. But
yes, sir.
You can see this.
Yes, sir.
You see, this is a compact harmonic, which you call. This is an ultrasonic waves it creates, and there will be a lead that will be connected to the. This is the harmonic probe, a kind of.
Okay.
This is an ultrasonic surgical shear. A compact system just generates the electropiezo crystals, And suture, no, it doesn't have. But my personal experience when I handle this, I don't use the prefixed sutures. I'll show you what I do. I do an intracorporeal fixation of the mesh after using.
Sir, I think for beginners, this prefix suture is.
Yeah, you are right. Exactly. Yeah, we also used to do that in the early practice, but I think now as you grow in the practice, you have some other way of more comfortable way. You don't use transfacial sutures. And
is it battery operated or?
It is not battery operated. I think it has got cells inside. No cells.
Dry battery, or we need to connect it to.
Okay, this is there is a, you can see this.
Right.
Plug
This
is for the the energy source, electric source, or a power supply, and this is for the outcome.
Yes.
For the piezoelectric crystals, this machine will convert the electrical energy into ultrasonic.
Right.
That is called the piezo crystals. This piezo
So beautiful innovation, I would say, because harmonic, you need to carry that big thing and all that.
Very true. So this is.
And I'm sure in future they may get it with a dry battery operated, because the way technology is growing.
Yeah,
I'm sure in future we'll have same thing with a inbuilt battery.
Absolutely, yes. So another point I would like to know about
in the upper abdomen,
right?
We should decompress the stomach, and same holds true for pelvic surgery. We have
Absolutely true.
Ask the patient to avoid or catheterize the patient.
Absolutely true. Absolutely. Another point I would lay a stress that in laparoscopy, your exposure of stomach is also important. Your allied points should be open. You should be around supraumbilical, and you should have the epigastrium open, because the amount of force would vary. So now the principle of port making, which you were talking about. Let me talk about the principle of port making. If my hernia is in M4 and M5, then I would preferably make catheterize the patient. In this patient, I have not catheterized. The reason is my area is M3, so I will not catheterize the patient unless there is some other issue for which I need to catheterize. But
simply, sir, we can say we have to start the absorption of this.
Absolutely, you can say that way. Otherwise, it will stay like that.
Okay.
Our idea is that once now it has started.
Thank you, Dr. CHALKOO,
Thank you very much
for this wonderful demonstration of IPOM Plus. It was really a visual delight.
Thank you very
watching
much,
you.
all of you.
A huge amount of applause for Dr. CHALKOO.
What is the status of OBG status of this? She is a married female?
Yes, sir. She's a married female since 1 year, but she has not conceived yet. She's a case of primary infertility.
Okay.
She has
I think this could be caused. These multiple fibroids, I could see.
This could be the cause.
Uterine distortion, architecture is disturbed. But fallopian junction, tubal junction looks okay outside. I think you need to go for a hysteroscopy also.
Yes, sir. Definitely, I will go for hysteroscopy.
I'm watching you doing this surgery.
Yes, sir.
Wonderful. So you will can you use a uterine manipulator from below? Which
Yes,
is-
sir,
yes.
definitely,
That will
definitely.
make your job a bit easy.
Easy, sir. Sir, but the thing is that it is only subserosal.
Okay.
So I have created a.
Right. You will deliver it out.
I think all the three are in line of
Do harmony,
same time.
The harmony.